I am coming at you live from Dr. Robert Beech and Dr. John Reid's oral surgery office. And I'm going to be going over your wisdom teeth extraction post-op instructions. So at the day of the consultation, you should have got a prescription slip that has 5 medications on it. There's the ibuprofen, Vicodin, antibiotic, anti-nausea medication, and then antibacterial rinse. Within an hour of getting home from surgery, we want you to get that ibuprofen in. Make sure you get some food in the stomach and take that ibuprofen. The Vicodin is going to be on an as-needed basis. You can do 1 to 2 tabs every 4 to 6 hours, but only if you need it, okay? The antibiotic is also started that evening. We do give an IV antibiotic, but we also want you to start the one that we give you that night. And then the antibacterial rinse starts the 4th day after the procedure, and surgery day is included in that 4 days. So when you come in that morning for surgery, you're going to get this little goodie bag. There's a couple things in here you're going to be using. There's an extra soft bristle toothbrush, and then there's also this Monoject syringe. So this Monoject syringe is going to be used with that antibacterial rinse. So what you're going to do, you're going to fill this syringe up. You're going to irrigate half of it into the lower right socket and half of it into the lower left socket. Make sure when you do flush, you hold out the cheeks so you can see where you're putting it. Make sure the tip is down in the socket and flush it till it's clean. You'll do that about twice a day. The bottle should last about 2 weeks, so please try and finish it. After that, you can do warm salt water rinses, okay? You will be biting down on gauze when you leave the office. Make sure you're applying really good pressure to it. You might have to change it a few times. Usually bleeding subsides within an hour or 2. So when you get home and you take your ibuprofen and you eat, make sure you take the gauze out and then place it back in afterwards. When you replace it, make sure it's all the way back behind the last tooth over the extraction site. Bite down and apply pressure. Again, pressure is what's going to stop the bleeding, okay? You will be on a liquid diet the first day. So soups, smoothies, jello, yogurt, things like that are perfect for the first day. You're going to be numb, so we don't want you biting down on your cheek or your tongue. The second day, you can kind of push yourself dietary-wise. You can do pastas and omelets. You can even do pizza if you want to, maybe even a cheeseburger, but just kind of push yourself a little bit, okay? Physical activity-wise, we don't want you doing any exercise for a good 5 days, okay? No exercise, no sports. So stay out of the gym and try not to go play football or anything. Anything cardiovascular within that first 5 days can cause rebound swelling and bleeding, and it can just double your recovery time. So just take it easy on that, okay? You will be icing most of the day. So usually 20 minutes on, 20 minutes off until you go to bed that night. It's usually a 24-hour cycle. When you wake up, get a little bit of icing into it. Definitely helps with the swelling, okay? Again, you are going to be very numb. Upper jaw usually comes back before the lower jaw, but the lower jaw can be numb up to 8 hours. So just kind of be prepared for that, okay? We did give you an anti-nausea medication, so please, if there's any nausea getting home, just proactively take that medication. It's a pill, you put it right under your tongue, it dissolves, and it works pretty much instantly. So if you're feeling any nausea when you get home, please, please take that medication. You can brush that night. Wait until you go to bed. You can brush your teeth, brush the sockets lightly. Just don't do any hard rinsing, spitting, anything like that first day. But brushing is fine, okay? So I really hope that your recovery is easy. I could tell you if you follow the post-op instructions, you should do just fine. Please call us if you need anything. We're here 24 hours a day. So I hope surgery goes well, and I also hope recovery goes well. Thank you.